Hey everyone, welcome to another deep dive. We love to get into the nitty-gritty of fascinating research, and today we're focusing on something that's super relevant to all of us as endocrinologists,
And that is
menopause.
menopause.
We're
Yes.
going to be talking about the physical and mental changes that happen during this transition,
Yeah.
and we're basing this deep dive on a really interesting study from 2003.
It's a classic. And you know what's really cool about it? They use the SF-36 to track all these changes.
Okay, the SF-36.
Yeah, a
Well,
tool we're all familiar with, right? But get this, the findings. They might just make you rethink a few things about how we manage menopause.
okay, now you've got my attention. Before we get too deep into it,
Yeah.
though, let's set the stage.
Yep.
We're diving into physical and mental health, changes during menopause transition by
Hmm.
Mishra, Brown, and Dobson
Yep. Published back in 2003.
in Quality of Life Research.
Right, and it was a longitudinal study. They followed over 8,600 Australian women
Wow, that's
for 2 whole years.
a lot of data.
A lot of data. And they didn't just look at menopause as one big lump. They actually broke it down into stages: premenopausal, perimenopausal, postmenopausal.
Interesting. So they really got granular with it.
They did. And they even looked at whether women were using hormone replacement therapy or not.
Okay, so lots of different factors at play here.
Yeah.
But why is this research so important for us as endocrinologists all these years later?
Well, we often think of hot flashes and night sweats as the main things with menopause.
Right, the classic symptoms.
Exactly. But this study really shows us that the impact of menopause on a woman's well-being is way more than that. It's more widespread.
Okay, so more than just those typical symptoms.
And honestly, more intense than we might realize.
Oh, am I all ears? What kind of intense are we talking about?
Okay, so this is where it gets really fascinating. The study found that women who were in perimenopause for a longer time actually experienced the biggest declines in well-being, especially physical well-being.
Hold on. So you're saying it's not even full-blown menopause that's hitting them the hardest? It's that in-between stage.
That's exactly it. Perimenopause isn't just a quick stop on the way to menopause. For a lot of women, it can drag on. And this study, with its use of the SF-36, really paints a clear picture of how tough that can be.
You've definitely piqued my curiosity.
Yeah.
Tell me more about those SF-36 findings.
Sure. So remember, the SF-36 breaks down well-being into 8 different areas: physical functioning, limitations due to physical health problems, pain, general health perceptions, vitality, social functioning, limitations due to emotional problems, and mental health.
Yeah, we use it all the time to get a sense of someone's overall health.
Exactly.
Yeah.
And the study found that all of those areas, particularly the physical ones, tended to go downhill during the menopause transition. But for those women stuck in perimenopause for longer, the drops were really dramatic.
Wow, dramatic in what sense?
It was almost like what you'd see in patients with chronic conditions like asthma or anxiety.
Very serious? So women in perimenopause are experiencing declines in physical function and overall health comparable to someone with a chronic illness.
That's what this study is suggesting. And that's a huge deal because it means we need to be way more aware of how much perimenopause can impact our patients' lives. We can't just brush it off as a temporary thing.
No, absolutely not. This is definitely eye-opening. But you mentioned HRT earlier. How did that play into all of this? Did women using HRT have a better experience?
Okay, well, here's where things get even more interesting. The study actually found that even women on hormone replacement therapy showed some pretty significant declines in a few areas of well-being, especially physical functioning.
Oh, really? So HRT isn't the cure-all we sometimes think it is.
It seems that way. And that's why this study is so important. It challenges our assumptions and forces us to really think critically about how we approach menopause, especially when it comes to prescribing HRT. It's not a one-size-fits-all solution.
This is definitely turning my understanding of menopause upside down. So we've got this pattern of declining well-being, especially for those in prolonged perimenopause, and even for some women on HRT. Where do we go from here? What does this mean for us as endocrinologists?
That's the million-dollar question, and it's exactly what we'll be unpacking next. This research really shows us that menopause is complicated.
Yeah, it's definitely not just about managing hot flashes or prescribing hormones.
Right. It's about really understanding how these big hormonal shifts can affect a woman's entire well-being.
Both physically and mentally.
Absolutely. And that's where we as endocrinologists come in.
It's like we need to change how we see menopause,
Exactly. Not just as a bunch of symptoms,
but as a whole transition with a lot of different aspects.
and that needs a more personalized approach to care.
Okay, so we need to move away from this one-size-fits-all thinking,
For sure. And really focus on what each patient is going through.
especially when it comes to that prolonged perimenopause.
Right. We can't just ignore that phase. It's a time when women are really vulnerable.
And we need to be ready to help them through it.
Absolutely.
Okay, I get that. But what does that support actually look like? We can't just make perimenopause disappear.
True, but we can make it easier. First off, education is key.
Makes sense. Knowledge is power, right?
Exactly. We need to make sure our patients know what to expect during perimenopause.
So they're not caught off guard,
Right, and we need to let them know they're not alone in this.
that their experiences are valid.
Exactly. But what about actually doing something? Are we just talking about HRT or are there other options?
Yeah, good question.
Well, HRT is definitely part of it, but it's not the only answer.
Especially after seeing those findings that some women on HRT still had those declines.
Exactly. We need to be careful about how we prescribe HRT.
So thinking about each patient's situation.
Right. Are there other things that might be better?
Like what?
What?
What are some examples?
Well, lifestyle changes can be really powerful.
Like diet and exercise and things like that.
Exactly. Things like regular exercise, ways to manage stress like mindfulness or yoga, and even changes to their diet can make a big difference.
It's about helping them take control of their health.
Right. And we can't forget about just listening to our patients.
Really taking the time to understand what they're going through.
Yeah.
Making them feel heard. So it's about treating the whole person, not just their symptoms.
Exactly. And this study, with all its focus on the different parts of the SF-56, shows how important that is.
We need to see how menopause is affecting their physical functioning, their mood, their social life, their whole well-being.
It's complicated.
So we're starting to get a better idea of how to support women through perimenopause and beyond.
Yeah, but what about that HRT finding? Where does that leave us? Should we be rethinking how we use hormone therapy?
Good point.
I don't think we need to throw HRT out completely.
But maybe be more careful.
Yeah, more strategic. We need to talk to our patients more about it.
Weigh the pros and cons.
Exactly, and maybe consider other therapies that might be a better fit.
So broadening our options
And I think we need more research, too.
to figure out why some women on HRT aren't doing as well.
Right. What's the right type of HRT? The right dose? Are there other things going on?
Lots of questions to answer.
And this is making me rethink how I handle menopause in my own practice.
I bet a lot of our listeners are feeling the same way.
And that's the great thing about research like this. It makes us question what we think we know and try to do better for our patients.
This has been a really insightful deep dive so
It
far.
has.
But before we finish up, there's one more thing I want to talk about. This study was published over 20 years ago.
Right.
So how relevant is it today?
That's a great question. And a tricky one. On the one hand, we know medicine is always changing. There are new treatments and therapies all the time. But the basic facts of menopause haven't changed.
The biology is still the same.
Exactly. But what about how we handle menopause? Has that changed a lot in the past 20 years?
I'd say so.
Me too.
Yeah,
We're much more focused on the patient now.
more holistic.
Right. And we understand the importance of lifestyle changes. But even though it's older, this study still has things to teach us.
So it's not like a rule book.
No,
Right.
but it gives us something to think about.
And discuss.
Exactly.
Right.
Makes us ask ourselves how we can use this information to help our patients today.
What can we learn from it?
And what do we still need to research?
I love that. It's all about taking the best of what we've learned and using it to move forward. Okay, let's take a quick break here. When we come back, we'll wrap up this deep dive with some final thoughts and some questions for you to consider as you think about this research and what it means for your practice. All right, we're back. And I don't know about you, but I'm still thinking about all this stuff about menopause and well-being.
It really makes you think, doesn't it?
It does. This deep dive has shown us that this transition is complicated.
It is. And we need to be more careful about how we handle it.
So as we wrap up, let's talk about the big takeaways. What are the main things we should remember from this research?
I think the biggest thing is that we can't ignore perimenopause.
Yeah, it's a really important time.
And it can have a huge impact on women's well-being.
So we need to be paying attention to that stage,
Absolutely. We need to be educating our patients about it
making sure they know what to expect,
and validating their experiences.
letting them know that what they're feeling is normal,
Exactly. And we need to be ready to offer support.
not just waiting until they hit menopause.
We need to be proactive.
I agree. And another big takeaway, HRT isn't always the answer.
Right. Just because it works for some women doesn't mean it works for all.
This study really highlighted that.
We need to be more careful about prescribing it
Thinking about each patient individually,
and having those honest conversations with them
about the risks and benefits,
and considering other options too.
like lifestyle changes.
Yeah, things like exercise and stress management and diet can make a big difference.
We need to be talking to our patients about those things. It's about giving them the tools to manage their symptoms and improve their overall well-being.
And I think this research shows us that menopause is different for everyone.
There's no one-size-fits-all approach.
So we need to listen to our patients
Understand their individual needs.
and create treatment plans that work for them
It's about moving away from that one-size-fits-all mentality.
and taking a more personalized approach.
But it's also important to remember that this study is over 20 years old.
Right. Things have changed since then.
So while it's given us a lot to think about,
It also shows us that we need more research
we need to keep learning
and stay up to date on the latest findings.
so we can provide the best possible care for our patients.
As we wrap up, I want to leave you with this thought. How can we use what we've learned today to make a real difference for women going through menopause? How can we be their advocates and help them thrive during this time?
Those are great questions, and I hope they'll stay with all of us. This research has definitely made me think differently about how I approach menopause care. I'm feeling inspired to provide more compassionate and personalized care for my patients. Thanks for joining us on this deep dive.